This is predominantly work by one of my co-workers and who is like teaming up with me. He's the head of the immune monitoring core at our clinic, so we do many things together. And he actually realized at one point that, or I have to start somewhere else. So different from many other centers, we are actually looking at the immune phenotype over time in all our patients. So we have patients 5 years out after CAR T, and we still collect their samples and we look at, do they have CARs? What does the immune phenotype look like? So we do a relatively broad, and that's expensive. That's why many centers don't do that. But we broadly look into their T-cell compartments all the time over many years. And we have patients, and that's what this story is about, where you find very weird phenotypes of T cells popping up over time. And the reasons for that is very diverse. We have a patient with an infectious complication. It's very rare, actually, a canine infection that this patient then had because of the immune suppression that the patient was suffering from. And we saw that by a T cell change phenotypically. Other patients have that just by chance. And this is really important and interesting because currently we talk a lot about T-cell lymphoma after CAR T-cell therapy and that there are certain alterations that we should be worried about. In those patients, we have stable T-cell clones that are oligoclonal or even monoclonal that are there for years, and they are just not changing. They're just there. They look phenotypically weird. That's why we got interested in them. And we are screening now our entire population, CAR T-cell treated population, to understand what the frequency is, where they come from, are they oligoclonal or not. Sometimes infectious complications associated, sometimes they're just there. We do chip analyses, right? So we wonder whether they do have a clonal hematopoiesis-like alteration. So that's all super interesting, and I think for the field it's important to understand that not every oli or monoclonal T-cell population that comes up is immediately a T-cell lymphoma, which currently everybody publishes everywhere. But I think we have to think a little broader, and what we see is that several patients have alterations, but we would never consider them being malignant.